Greetings, Light Tribe, Janine Palmer here. I try to keep my videos short, like 3 to 5 minutes. Sometimes they go longer, sometimes I need to make them into 2 or 3 parts. Okay, this, like the other videos, is for the purpose of discussion. This video is not in any way, shape, or form attempting to give anyone any advice about anything. Okay, it's just to open you up to more awareness and to taking responsibility for things like to broaden your knowledge, okay, your search for knowledge, finding more information about what your options are. And I'm talking about health issues, okay? I'm talking about what doctors say to people that oftentimes they probably really have no business saying, okay? Now, I'm sure, like so many other people on this planet, are very thankful for doctors and hospitals and nurses and all that they do to help us, because sometimes that kind of intervention is needed, okay? There's also stuff way beyond the scope and ability of a doctor's skills, okay? And or his ego and his bedside manner or lack thereof, in some cases, as many of us have been introduced to. So I will probably make this into 2 videos, but this is something that I learned in my studies, okay, and I want to share bits and pieces of this with you in case it's of any help to you, as I said, to broaden your awareness. So I had a family member years ago who went through cancer surgery, subsequent treatments, and I studied things for her. So I read Suzanne Somers' book, Knockout, where she was interviewing doctors who were curing cancer. Well, the AMA didn't really like that, did they? They were trying to shut those doctors down, but their patients showed up in droves to support them. Because there are a lot of ways to cure and heal disease, and doctors can help with that. But what they learn at the AMA isn't the end-all be-all, okay, of cures and treatment and healing. And doctors oftentimes make statements that they have no business saying, okay, because oftentimes they're quite wrong. They're not God. Most of them probably don't see into the future, and they can't predict how long a person will live because they're not taking into consideration the strength of the human spirit, okay? That's separate from the body that the doctor's helping to heal. Healing happens on many levels, okay? So, if you were to read Suzanne Somers' book and other ones out there like it, and they're going to talk about treatments that you can use in conjunction with traditional therapies. They're going to talk about certain vitamins and supplements, herbs and things like that, that are helpful. You might learn about IP6. You can Google it. Okay, it's a supplement. It's assisting people. Of course, Big Pharma doesn't want you to know about that because they're taking, like, the herb chaparral. You used to be able to get it at the health food store. Well, when they started discovering the anti-cancer properties, they pulled it from the shelves because they want to corner the market on that. They want to use it to make the drugs and then charge you an astronomical price for it, because stuff like cancer is big business, isn't it? Anyway, there's all kinds of natural things that you could take, digestive enzymes, all kinds of things that you can take to help prevent or cure, heal, whatever diseases, cancer, stuff like that. So you can do the investigation for yourself to find out what those are. Baking soda also will balance your pH to get rid of certain diseases. Changing your diet, a lot of, like I said, the enzymes, raw fruits and vegetables, that kind of thing can help you. This is investigate, taking responsibility for your health, gaining knowledge, and then making your own decisions. And then you can talk to doctors who will do both. Some doctors are regular doctors and they're naturopathic doctors. Okay, so they include way more than like, no offense to regular doctors, as I said, very grateful for them. They're trained in certain things, or certain things they don't learn about the homeopathic stuff, so they don't include it. They don't know about it, and it's like they don't want to go there, okay? But there are doctors who do, and sometimes that works for some people. Okay, so I'm not putting down like straight line regular medical treatments, because they do help. But I'm going to go into part 2 because I'm already over 5 minutes on this video, because I want to talk about what doctors say to patients and why they shouldn't. Okay, how it's very harmful. That was the intention of this video, but I sort of had to work myself up to it, including bits and pieces of those other information for whatever good it might do. Anyway, just to have more awareness of the choices that you are going to make for your health care or the health of family members, because healing happens on many levels. So I'm going to stop this one, and then I'm going to do part 2 because I want to talk about this. It's very important.